So I've been an innovator for many years since I really started a residency, and personally, it's been a journey about recognizing that I thought healthcare had some real issues that I believed I could help with, and so. The process of learning how to innovate in complex organizations has been a challenging one and a rewarding one. Learning how to really to make change and do things in new ways in high-performing organizations is really an art, and I've learned a lot in that journey. And the rewards now are to me are innumerable, including the satisfaction of really changing the way we deliver care. But it is not simple, and there is that process of learning how to innovate in high-performing organizations is something that I think that the world needs to know more about. And so part of my role and part of my interest is to really hopefully show and to train people how do you innovate in a rational way that really drives performance. So here at Geisinger, we are convinced that the challenges before us in healthcare, between the high cost and poor quality, are too great, are so great that the current methodologies of incremental value improvement won't get us to where we need to be in order to meet those challenges. So we believe that not only do we have to improve quality and we have to improve our efficiency, but we also ultimately at the end of the day have to do things in a new way that allows us to really almost change the game by how we deliver care. Those new models of care delivery is really what we're after. The United States spends more than 30% more than other industrialized nations on health care. And our quality is not what it should be. And so we really are trying to attack that problem, leveraging anything and everything that we can find in terms of HIT and the principles of reengineering and clinical decision support, et cetera, to see can we, as an organization, really become a model for American healthcare through ongoing continuous innovation. Some of it's worked, so that's exciting. So I tend to focus on the area that sits between clinical medicine, principles of reengineering, clinical decision support, electronic health records, and analytics. And some of the more fascinating work we've done has been around reengineering ambulatory care with what we call our Care Gaps program. We have a number of fantastic people here who work on that problem. And the real gist of it is can we, in a really transformational way, identify patient populations that have needed care needs, and can we identify them and close those care gaps using new care models. So some of that has to do with implementing data systems to be able to support all that. Some of it involves workflow redesign where nurses do things instead of doctors. Some of it involves developing rigorous new processes around automating stuff that used to be done by physicians. And we've had some real successes. So our ability now to identify patients and get them what they need in such a way that it's more efficient and more reliable has grown tremendously over the last 4 to 5 years. And what's sort of exciting about that is now that once you prove it, that's one thing, but can you change a culture of an entire organization around that message of our job to some degree is to find, identify, and close gaps in care has spread throughout the organization. There's it wasn't something that I started or something that I'll finish, but it is a living, breathing animal now that really has taken over, and the vision around that is exciting, and the toolkit that we've created is robust, and it will only continue to be more so. So we've closed 50,000 care gaps our first year, and this year we're on track to increase that number by 30%, and there'll be financial improvements. But also exciting is that if you actually do what patients need, in terms of chronic disease care and prevention, you can actually save their lives or improve the quality of their lives by reducing amputations for diabetics or reducing fractures for patients with osteoporosis, etc. So it's very exciting, and we have some, like I said, great people who have helped build all this stuff and implement it. And now really some of the fun part is really evaluating the impact and seeing, can we really take care of patients more effectively.